and a clinician scientist who also has a focus on understanding the causes and treating with unique approaches obesity in children.
Thanks, Dr. Levitt. So I have the privilege of running our obesity medicine program here at Children's Hospital Los Angeles. We know that the rates of pediatric obesity have been increasing over the past 30 years. And if these rates continue, we know that by 2050, more than half of young people will be living in larger bodies. And while the size of one's body and the number on the scale is not what is important, we know that young people living in larger bodies have higher rates of developing life-limiting complications like type 2 diabetes, high blood pressure, high cholesterol, and like Dr. Coley said, developing collections of fat in the liver, all of which can lead to life-limiting complications and impact quality of life and health over time. Emerging science has taught us that individuals living in larger bodies have differences in the way that their body and their brain controls when they're hungry and when they're full. I like to think of it like a light switch, and the light switch gets sticky when it's moving between being hungry and being full, as well as differences in the way that their body controls what they do with the calories that they eat. Instead of using those calories as fuel, they take in those calories and store them immediately as fat. And so what we do here at Children's Hospital Los Angeles is that we have a comprehensive obesity treatment program where we integrate lifestyle modification, obesity medications, and weight loss surgery to try to help children living in larger bodies live longer, healthier lives.
So you preempted my question that I was going to ask in terms of the treatments that we're doing here. And you mentioned three. Can you repeat those again? Because I think it's a unique approach and a multidisciplinary approach. And you also mentioned brain body, and I was wondering about some of the advances that we're seeing clinically in terms of applying behavioral health in this area. Maybe you can focus on that a bit.